going back to testing in pregnancy, one of the big things that we test for at 28 weeks is screening for gestational diabetes. And the standard of care is to do the glucola, which is a very intense, sugar rich, although I've seen them trying to come up with some alternatives that don't have food coloring and stuff like that. But from a midwifery perspective, we are starting as soon as someone comes into care. We're, I don't know if all midwives do this, but my lineage, the midwives that I was taught by, we always do a diet diary by the second visit. And so we're looking at what is their normal way that they're eating, and then making tweaks to do preventative care, lowering carbs, increasing proteins, making sure that there's a rainbow a day. So they're having lots of veggies and fruits in their diet. And then hopefully, and I always do an A1C in my initial labs so that I can kind of see where we're starting at. And that in combination with their diet really helps me get them on the right track as soon as possible if, they come into care early. I personally, yeah.
Do you do an A1C on all your new?
I do.
Okay.
I do, and I also do thyroid, but we'll talk about that when we do the initial lab conversation.
Right.
Yeah. I always do an A1C, just because then I have a snapshot of what's going on before we get to 28 weeks, because I don't want to wait too long if we're having an issue early on. So I personally don't offer the glucola in my care. I mean, if someone really wanted the standard of care, I give them the information about that, and then I can send them to the lab, but I don't keep any in my office. And I speak to people about, if we're eating healthy, the likelihood that you're going to have a spike in your sugars from drinking that, gestational diabetes is way overdiagnosed as well. And as soon as you get into that classification, you're treated very differently and you go down a path. So
some doctors and clinics will use 130 as the cutoff. And there's so many more false positives with 130. ACOG even recommends, they say they're not making a recommendation, but they even say that you should probably use 140 as your cutoff. If you're going to do that, you're going to do the traditional 50 gram 1 hour post glucola testing, which you're going to talk about right now as to alternatives.
Yeah. So, other midwives offer things like organic jelly beans in, a certain amount of them equal to the 50 grams, drinking, a sugary drink that's an alternative like orange juice or something that could give you that. There's a very specific meal that you can have that has a lot of carbohydrates. It's kind of laid out for you. When I was in LA, especially, I took care of a lot of people who were vegans and vegetarians and, have all kinds of alternative diet restrictions or preferences. And so, what makes most sense to me is to test how my clients eat and ask them, if you ever splurge, if you have a cookie sometimes or ice cream, or you like to drink juice or whatever, have that day, because I want to see how your body responds when you're eating normally and you have sugar.